You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, cosmetic dentistry, smile makeovers. According to my first guest, he says that small improvements made to your smile can make a big difference in not only how you feel about yourself, but how others react to you. Today, we're talking about dramatic smile makeovers with America's prosthodontist, Dr. Alfonso Monarres. Dr. Monarres?
Randy, hi.
Welcome to the program.
Thanks for having me again, my friend.
Now, we've had you on the program before, and you always bring a lot of photos, so we'll try to get to as many of those as possible.
Got many more now. So.
Now, for people that don't know your practice, because you're in a new location.
Correct.
So tell us a little bit about it. Who's the typical patient?
Well, thanks for asking. Over the years, I've learned a lot. And my typical patient is that patient that's right now at home thinking, you know what, I don't like my teeth. My typical patient is not the patient that broke a tooth last night eating dinner, or had a cavity and is hurting, when they eat, something. My typical patient is the patient that's been suffering for years and is hiding at home and can be himself or herself. And sometimes they don't even know that, but they stop smiling and their lives have changed and the lives of the people around them have changed. Sometimes they don't even know there's something that can be done. Sometimes they've been told many times that there's no solution to the problem. And my typical patient is that patient that's looking for hope and for someone that can look at them in the eye to say, and can say, you know what, I'll help you. And you don't have to live the rest of your life this way. There's a chance for you to smile again, and you're gonna be happy and healthy, and I'm gonna take care of you. So that's my typical patient. The type of people that we see, are number one, people that have disease, that have suffered, that are not lucky with what Mother Nature gave them, and is suffering because of cavities, and they don't like their teeth. They're missing teeth. The teeth are, they have the wrong color, the shape, the size, and things like that, and they're suffering. There's another kind of patients that also need cosmetic dentistry and want to improve the smile. This is a regular patient that has healthy teeth, but it's looking at themselves in the mirror and they see, well, there's a little bit of wear there. They're getting a little darker. I don't look as young anymore. And there's nothing wrong with my teeth, but I want to look better. Is there anything that can be done?
Picking it up a notch a little bit.
That's right. I mean, everyone wants to look better, right? Everybody tries to exercise and eat better and get smarter. And people usually in this time, they like to invest in themselves. That's what Warren Buffett says, and Charlie Munger and all those guys. You got to invest in yourself. And one of the best investments they can do is to invest in their smile. My lovely wife likes to say, you got to invest in your smile, because the more of those that you collect, the happier you are.
So you have this concept where you do everything in one day.
That's correct.
Things are faster now, I guess.
It's got to be. And now we think, what's better for my patient? Nobody wants to be in the dental chair forever. And we try to do things in one day. Whether we're fixing teeth, that means, repairing what's there, or we're replacing teeth, that means, helping people get what they lost. It can be done in a very short amount of time. Many times these patients get IV sedation, so they don't even remember anything.
Yeah, you're big on sedation.
Absolutely, yes.
Because nobody likes going to the dentist, right?
Well, yeah.
Do they ever say that to you, like, no offense?
Yeah, every day.
Really?
But I mean, I know they don't mean wrong. Some of them have bad experiences, and I get that. I can't change that. But I tell them, from now on, I want to change your concept of dentistry. I want you to come here with a smile, knowing that there's hope, that you're going to come out of here. Like if you just went to bed and had a wonderful dream, you wake up and it's right there. At the end of the day, most times they don't remember anything. They come early in the morning, and then we get them very comfortable, whatever the situation is going to be. But my goal is that at the end of the day, when they grab the mirror, everybody has a great smile and a new life.
Now, because we're talking about smile makeovers and porcelain veneers today, I feel like I could spot somebody with veneers walking down the street. It's like they're big or they're bulky.
Correct. And those.
Is that because the patient asks for that, or is that the doctor?
No. I don't. That's not the patient's responsibility. It's the doctor's responsibility. That's our job.
Okay.
To me, the most successful dental dentistry, cosmetic dentistry we can do is the one that nobody can notice. I mean, our job is to have an eye for the things that look natural. We want to mimic Mother Nature. And we want people to look really, really good, but without you knowing that I did it for you. I want people to say, hey, you look younger. Randy, what did you do to you? Is that a new haircut or I don't know? But you look wonderful. And because they can tell that your smile is different. You just shine because of what's between your lips.
Now, you're a dentist.
Correct.
So you probably think like the smile is the most important thing.
Absolutely, absolutely, by far. If you look at research on Muscle Health magazine, they say what's more attractive for a patient, for a person of the opposite gender, is the smile. You think they're going to look at other things, but the reality is what's most striking is the smile. One thing we like to say is that your smile is like your logo, and
Okay.
and yeah. And the way you make people feel with experiences around you when you smile is your trademark. So and that makes your personality, what becomes your business card. So the smile really portrays who you are, and people that stop smiling really stop being themselves, and they're not as happy. Back to your original question of who's my typical patient, we also have patients that come with dentures. And dentures look like teeth for the rest of the world, but
You don't like dentures.
oh, nobody likes dentures, Randy. They look like teeth for everyone else, but not for the patient. Can you imagine having a big piece of plastic in the mouth and waking up every morning having to deal with that? For centuries, dentures were the only option for patients that lost their teeth. And they had to deal with that or live without teeth.
All right.
But now we have much better options. For denture wearers, they can come in, get a full set of implants and walk out with a full set of fixed teeth in one day. So it's fantastic. It's changing somebody's life in a very short amount of time without having to feel anything, and it's the closest thing we have to mimic Mother Nature these days. It also gives us a blank canvas, Randy.
Okay.
Fixing teeth sometimes is difficult because we have to deal with what's left there. Replacing teeth gives us an opportunity to you
Like
choose
recreate the whole thing.
Right. And one of the most fun things that I do is a smile design appointment. Before I treat a patient, I sit down with them and we play. It's like designing your wedding dress or things like that. Yeah. And then we take pictures, we take measurements, we become friends. I'm trying to earn their trust.
Okay.
And I tell them, looking at them in the eye, there's no excuse why I shouldn't be able to give you exactly what you want, because you're giving me a blank canvas. And if you communicate that to me, we can choose the color of your teeth, the shape of your teeth, the size of your teeth, perfectly place them between those beautiful lips. And when we're born, we don't choose what Mother Nature gives us, right?
Okay.
We get genes from mom and dad, and if I'm really tall and really big, and I can have small teeth, but that doesn't look very good. So when we replace teeth, we actually have a second chance to choose what we really like and what really fits us well.
So since we're talking about porcelain veneers and cosmetic dentistry,
Right.
when I do see those big bulky veneers, you're saying that is what? And I don't want to put words in your mouth, but maybe the lack of experience or artistic talent of the dentist?
That's correct. That
Really?
could be
Okay.
that could be lack of experience or lack of an eye for art, because dentistry is part of science and a big part is art.
All right.
And to me, you got to look beautiful. I mean, in general, people should look at their best. So when you see veneers that look fake, it could be the preference of the patient that I doubted, who wants to look fake and show teeth that don't look like teeth.
Okay.
Or that the dentist doesn't really know, what really makes a smile look good. You'd really have to have an eye for this. And there's not a lot of
You're a
people.
perfectionist?
Yeah.
Do people call
say
you a
that.
perfectionist?
All the time, yes. I don't know if that's a good thing or bad thing, but I love it. I tell my patients, we're gonna give you our best effort.
Okay.
I'm not gonna stop until you love your teeth or you tell me to stop.
Well, that's nice.
And we're gonna have fun together. And at the end of the day, we're gonna be friends because I'm gonna earn your trust. That's my goal, really. And I really mean it. I want to look at, once again, patients in the eye to tell them, there's no excuse why I shouldn't be able to give you this if you trust me.
Okay.
Now, don't trust me yet. I want to earn that trust first.
Nice.
And if they trust me, I go to war for them. Until they tell me, Doc, I love this, then I graduate them.
Now, with the cosmetic dentistry, what's that process? Like, how do you decide what their teeth are going to look like? Like, how do you show the patient is what I'm saying?
That's fascinating. You're going to have to give me another half an hour of the show because that's my passion. First you got to understand what a beautiful smile looks like. And I brought a bunch of pictures and I'll show you in a minute.
Okay, we'll get to those.
But when somebody smiles, regardless of age, gender, color, size, shape of teeth, for example, you don't want to see a lot of gums. You don't want to see a lot of lower teeth. You want to see a beautiful frame for that smile. I always start with the upper front teeth, because those are the ones that should show in a beautiful smile.
Okay.
If you show your lower teeth, that doesn't look like a very good smile. You're not a dentist. People are not dentists, and they can tell if I'm just showing my lower teeth, that's not really pretty.
Okay.
Or if I tell you a great joke, and you're laughing out loud, but your lips are this close together and I can't even see your teeth, that's not really
So you
nice.
can fix those things?
Absolutely. And I can pinpoint right away when people are talking. I try to tell them some jokes because I want to see them smile. Okay. And I want to take pictures because once the patient goes home, I don't have their lips, I don't have their eyes, and it's a whole thing.
So when you're with a patient, just to see how they normally would smile, you try to tell them a joke.
Oh, absolutely.
To try to get them to laugh.
Yeah, absolutely. I mean, obviously, I have to be careful. I have to get to know my patients.
Yeah.
Because sometimes I tell them, hey, just smile for me. And they're nervous. They're like, well, what is this guy trying to do? And well, that's not a very natural smile. I want the natural smile. I want the smile that they're going to give to their wives or their kids or their friends. Because one of the most important things for me is to design a set of teeth that flows with their eyes, with their lips, and there's no limitations for this. I can change lips, I can change the shape, the distance. I can make people look younger just because of how we do the position, the size, the shape of teeth. Now, I start with the upper front teeth because those are the ones that are attached to the head.
Yeah, okay.
The lower ones move, but the uppers are always there. So if you have a good set of upper front teeth, if you ask me, that's where I start. That's never going to change. If I get you a good set of upper front teeth,
the upper's good.
We're going to be friends forever.
Now, you're a prosthodontist, okay? So I guess the prosthodontists are the ones trained in this type of dentistry. Is that right?
That's correct. We spend extra time in school, learning how to design smiles, how to be the master diagnosticians. We're often called the architects of the smile, and we look at all those little details that make a smile look amazing.
I'm not trying to side with you. People need to know. I'm trying to not get on your side, but I've seen your work and it looks really good. But you also have a lot of reviews. I mean, your patients are like fans of yours.
Well, that's.
I mean, you do have a lot of reviews, right?
I do, and it's very nice to have people follow us on Facebook.
And they write like long things about you.
It's hard, it's very emotional for me because I have passion for what I do, if you can tell. People follow us on Facebook and Google and Instagram, and they see the work we do. One of the things that sometimes breaks my heart, Randy, is that I see these people and they say, I really hope I could have that. And I want them to know that anyone can have that. There's hope for everybody. I don't like to see people in family pictures that everybody's having a great time and somebody is like,
one person's not smiling.
Yeah.
You see that all the time?
All the time. And here's the very important thing. Sometimes they don't even know they're doing that. They think they're happy. They have this idea that they're enjoying it, but the rest of the world is seeing something totally different.
Interesting.
So if you tell me a good joke, Randy, and because of my teeth that I don't like and I don't feel comfortable with, I learned for many years to hide them. I'm gonna say, in my mind, I'm laughing, but you think this guy didn't like me or didn't like the joke. And the whole perspective of how the world sees you changes. So sometimes people don't even know they're doing it. And one day they realize, wait a second, geez, this is not right. And they don't know what to do. And that's what I'm here for.
So at the top of the show, because we've talked in the green room, that when you fix somebody's smile, whether it's porcelain veneers or whatever, that they smile more. And people treat them differently.
Absolutely.
Is that right?
Randy, we see it all over and over again. When I meet a patient, I tell them, listen, I've done thousands of these cases. And I have. I've been blessed and lucky to have a lot of experience with these cases, with teeth and implants and all that kind of stuff. And the coolest thing is not about teeth. It's about how this dentistry can change people's lives. The dentistry is the easy part. That's why I tell them, I'm going to take good care of you. Don't worry about it. I'll take care of you.
Okay.
But we're going to be friends forever. And I want you to come back feeling happy, feeling healthy. I don't want to see you in my chair with problems, so we can have coffee any day, but I want you to bring you good stories and tell me that life is great. Because it can be great. I honestly...
And you say they even dress differently?
Absolutely.
Like you fix their teeth and they come in, they're not even the same people.
They come back totally different.
Really?
I have a lot of cool stories. Recently we were taking a trip, and this flight attendant came to me, and I thought she was going to tell me to buckle my seatbelt. And then she looks at me and I said, Dr. Monarres, thank you. I said, wait a second. I look at her like, oh my God, she was one of my patients. And you could see her down the aisle.
You brought that photo. Could you show that photo?
Yeah, absolutely.
And I told you, because you said that she's working with one of the airlines that I go on.
Sure.
I said, that smile, I remember thinking, this woman smiles incredible.
She's gorgeous. You see her working and she looks totally different. You see all the other people that work there and they look like, well, they're on the job. She looks happy.
So right there, so somebody just took that photo of you two.
Yeah. I mean, we were with very good friends traveling and she came to me. And honestly, I didn't recognize it at first until I saw her and like, oh my God, is that you? And that just made a huge difference.
Well, she had the best smile on the whole plane.
Absolutely.
That's for sure.
Absolutely.
Right?
And that's what it's all about.
And they look real. I have to admit, too, they look real.
That's what we want. The people, and this is good and bad, because as a doctor, they tell you, well, who did it? Well, they don't want to tell that, those teeth are not, the ones Mother Nature gave them. This wonderful lady all of a sudden came to me. I'm the doctor now. I was a kid running around her living room for many years. And I tell her,
she's a friend of yours, mother's.
Yeah, from many years ago. And now I tell her, she had dentistry done for years. She did everything right. She went to the dentist, but she wasn't happy. So I tell her, I can help you. You can have a beautiful smile. And she trusted me. And look at her now.
Oh, wow.
Look at her. She looks younger. She looks happier. Look at the shape of her lips. Look at the expression of her face. Night and day, Randy. And anyone can have that. This is something that any human being should have access to. And I want everyone out there to know that there's hope, that they don't have to live their life suffering.
So if you don't like your smile, do something about it. That's your field.
Absolutely. There's things in life we can't change, unfortunately, right? And well, that's life. But you can change your smile, and you can have a wonderful life. I can't express enough the power of a beautiful smile. You're gonna be different. You're gonna influence the people around you. You're gonna change the life of many others. You're gonna be the sunshine of many lives, and that's just gonna fill you with joy. And
we talked about this. People with bad teeth, crooked teeth, discolored teeth, are judged. Like in the movies, right? If the director, and we've had this conversation, if you want to make somebody look poor, you give them bad teeth in the movies.
That's right.
You want to make them look not very smart, you remove one of their front teeth.
Correct. Or you make them crooked, or you make them dark, or things like that. So that's sad, but there's reality. People judge people because of the way they look, and sometimes people go through life suffering because the way their teeth, are, and many times it's not their fault. Many times it's not their fault. It's whatever they got from Mother Nature.
So there's a lot of people, because you call it suffering,
Absolutely.
Right? And that's kind of dramatic way to put it, but these people are pretty miserable about their teeth, is what you're saying.
I see couples, Randy, that come to the office, and it's husband and wife, and all of a sudden I put the X-ray in front of them, and let's say the husband is the patient and the wife is coming with them. I said, do you even have an idea what your husband goes through every day when he gets up? They look at the X-ray and oh my God, I didn't know that was him. Because people don't have X-ray vision.
Yeah.
If you're missing an arm or a leg, that's very unfortunate, but everybody knows. But when you're missing all your teeth, and you
have really bad teeth.
That's right, or you have bad teeth and you don't want to smile, and your brain tells you, close those lips, you suffer, and your life changes. But some people are very nice. They take care of others, and they don't share that. So it's amazing to be able to help somebody.
When should you get cosmetic dentistry?
Anytime that you're not happy with your smile, anytime that you have that wow moment in your life when you realize, geez, I'm not happy, I'm not smiling, I'm not being myself, I'm not enjoying time with my grandchildren, I'm not kissing my wife, I'm not getting that promotion at work, I'm not finding my soulmate outside because I don't feel comfortable. There's no excuse for that. Everyone deserves to have a great smile, and we can help them.
Now, you have financing available, because obviously,
Absolutely.
Insurance isn't going to cover veneers and things like that.
Correct.
But do a lot of people finance?
Most patients finance.
Is that right? Okay.
You treat with the highest of the highest. I like to cater to normal people.
Okay.
I think everyone deserves to have a great smile. My patients are not rich and famous, like many of your doctors that come here. I treat normal human beings, and I want to help them all. I want them to know they have hope, and I want to be the person that looks at them in the eye and says, I can help.
So you brought photos.
I brought a lot of photos, and I know we're short of time, so I'm going to rush through these, Randy, very quickly, because I want people to know that things can be changed and there's solution for the problems. So here's a young man, he's healthy, he's young, he's good looking, has a lot of life ahead. He just doesn't like his smile. And when you look at it, you see that his lips are not symmetrical, that he barely shows his teeth, that are not in very, very best shape, color, size, and cosmetic dentistry can change his life. I mean, he has a lot of life ahead. We did some restorations, and now look at the shape of his lips. Now,
looks nice.
He looks amazing, and we put teeth that fit him. It's funny. You may laugh about this, but when I look at a patient, I need to find a tooth that fits them. Almost like this tooth fits. It looks like you. Yeah, because we get what we get from Mother Nature, but I think the tooth should look like you. And I choose a tooth that looks like the person. And I get to know their personalities. So I almost like if teeth could talk, they would be you.
Okay.
And I try to put those teeth in the right place, the right size, the right color. So this is another one. Nice professional lady. She had a lot of dentistry done, but the dentistry that's just like, okay, to solve the problem, get the cavity taken care of and, get you to chew and just do what you have to do with your teeth. But, you see the amount of display of the gums? That's not pretty. She smiles, she shows her teeth.
Is that like a gummy smile?
That's
you guys
called
call
a gummy smile, exactly. So in this case, I told you earlier, a beautiful smile is the one that shows upper teeth, not too much gums, not too much lower teeth, and they fit perfect between her lips. So we help her with a little bit of surgical procedure to get the teeth in the right place, okay? We put the right size, color, shape of teeth, and you can see that now her lips are a lot closer together.
Very nice.
The shape is totally different, and she looks now amazing. I mean, night and day for a professional young lady that's looking to thrive and find, happiness in life.
Good,
right?
Good.
And now this is another one. Another lady that you can see, she's smiling and you can even see her teeth. The lips are basically close together. You can tell her the best joke in the world, and you don't see anything because the lips are so close together. When the jaws come close together, there's no space for the lips to separate. Okay. So in this case, we need to put the teeth in the right place. We need to open the bite. We need to get the relationship of how the teeth come together better. And then all I have to do is put a picture on that frame, and they're gonna look amazing. And you know what? Her personality before and after, night and day, totally different people.
So they have more confidence.
Oh, more confident. Happy, smiling. They look smarter. They have more wealth, and it's just a wonderful change for this patient.
Like when you take care of teeth that somebody hates, and now they get their teeth, again they become like a different person.
Absolutely. And sometimes they don't know about it. And a lot of times patients, when I go through these fun appointments, when we design the smile, I measure things and I show them, this is more or less where a tooth should be. If you want to look really good, then like, wow, I didn't know any of that stuff. I say, don't worry. That's what I do.
Because some people, I just want to know how you do it, and the other people just say, just do it.
Right. And I love both. Don't take me wrong, but I want them to just, I want to earn their trust. And when they trust me, I'll get the job done.
I mean, you are like San Antonio's cosmetic dentist, right? I mean, people know you. I mean, because you've helped a lot of patients. You've been on TV with me before. Quite a big following. So good for you. Good for you. Time for a few more photos. All right. And I'm going to rush you on these.
I really want to tell you this story because this one touched my heart many years ago. Okay, I used to teach at the dental school in San Antonio. And one day when I was working, a kid walks into the clinic with his mom. And they tell me, this kid has missing teeth, and the permanent teeth have not normal shape. So I love the kid. He reminds me of my son right now, about the same age when I met him. So we click right away. And I said, well, but you're too young. You have to grow a lot. So I'm going to help you have a smile, have the teeth that are going to get you through your childhood and adolescence without, other people saying things that can affect you. And he's the coolest kid. He was
because people were making fun of his teeth.
Yeah.
Is that right?
Obviously, yeah. But he grew up being a perfectly normal kid, very happy. He was a BMX biker, and I gotta say I love him like a son.
Okay.
So the family moved out of town, and I lost him. One time, thanks to you, by the way, because I've been here before. They told me we saw you again on TV. We came back to San Antonio, and we knew where you were. Also, I see this guy that's all hairy and with a baby, and the lady walking in my office, and I recognize the lady. Like, I know this lady. It was his mom that I talked to many years ago. And he told me, Dr. Monarres, I'm back. I'm ready. I want my smile. And look at him now.
Wow.
It's life-changing. That's why I get up every morning and go to work. Changing a human being's appearance. And now imagine the future of this kid now. Yeah. I get choked up because when mom saw him for the first time with teeth and with a baby in his hands. Here's another patient, beautiful lady. She's a mom, she's a wife, and she hasn't smiled in a long time. She's a happy lady. But you can see when she smiles, you don't even see her teeth because of she was not.
So on the consult, do you think this is going to be good? Like,
Absolutely.
Do you see that end amount?
I feel like Michelangelo looking at a piece of rock, like saying, I can get this done. Like right away, I have a vision for what can be done, and I just want to put them in my chair to help them.
Okay.
Because I know she's going to be amazing, and you can tell.
Looks very nice. She looks good.
And we did it all in one day under IV sedation. She didn't have any discomfort. She didn't even remember what happened. Grabbed the mirror. She was a different person.
So IV sedation. So most of these people, they go in, you numb them up, they get the IV. They almost don't remember the procedure. Is that true?
That's correct. My goal is to make them feel so comfortable because some of them are afraid of dentistry. Afraid of dentists.
Well, nobody likes going to the dentist.
No, but some of them have bad experiences, and that's why they went away from the dental system. Okay. So I tell them, please trust me, you're going to be very comfortable, and this is going to be like a dream come true. You're going to come here one day early in the morning, because I'm an early bird. We give them sedation. They forget what happens that day, and by the time it's time to go home, they look at their teeth, and they're different people. They're a different person. So now the most beautiful thing is sometimes, everything that happened before, it's gone. They look forward. They can.
So many of these people haven't liked their teeth.
Correct.
Their whole life.
For years.
Is that right?
For years. That's what I was trying to tell you. My practice is not the patient that broke a tooth last night eating ribs.
Yeah, it's not like standard general dentistry. These are people that are big makeover patients.
Yeah, this happens in a long time. So, but one day they say, "Geez, I got to do something about it," and they come to me. And that's my passion in life. I get to help them.
We are out of time.
I'm sorry.
And I want to thank you for coming.
Let me do one more. Let me do one more because this is powerful. This is powerful, Randy.
Right.
I promise I'll go really fast. But this is a young man. Okay, that was he's young. He's in his 40s, and he grinded his teeth severely. So he doesn't smile. He doesn't go out. He doesn't have a soulmate in life. He's looking for love. He's looking for happiness. And he came to me with tears in his eyes with his mother.
Wow.
And I tell him, wait a second. I can help you. And he's probably one of my best friends right now. He trusted me. We gave him, a full amount of restorations. His teeth now have the right size, the right shape, the right color. And he looks amazing. Now he's just, I just feel so blessed and lucky to be able to help people like that. And I want everyone else to know that there's hope. There's things that can be done. They don't have to live their lives at home. Thinking that they can have the smile they want. The smile of their dreams can be achieved. And there's a lot of guys out there that can do it, but I'm happy to help in San Antonio.
Okay, good. Final message, somebody watching this, they don't like their teeth, but for whatever the reason they're putting it off, or they're afraid, or they're worried about pain or whatever, or maybe they think they're too far gone. What do you say to them?
Well, if they're seeing me with you a few minutes, I hope you don't think I'm a scary guy. I'm going to listen to you. I'm going to look at you in the eye. I'm an empathetic listener. I want to know what's important for you. I want to be that dentist that gets to your heart, and our heart is in your smile. So I want to make sure you get what you want, you get what you need. The rest, it's up to me. There's hope in life. Everyone deserves to be happy and healthy. Give me a call.
Dr. Monarres, thank you for calling the show.
Randy,
Great stuff.
Thank you, my friend. Awesome.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.